So in my experience as a physiotherapist working with stroke survivors, there really are three main challenges that I've come across that people have identified as barriers to getting started. One would be motivation or lack of motivation. A second would be depression, feeling quite depressed after a stroke, this life-changing catastrophic event. And then the third would be just feeling that they don't have the physical ability, that they're too disabled to exercise, that exercise is not right for them. So if we look at the motivation, it's really just finding that inner spark, that inner resilience that to want to go on with a different path in life. So sometimes that needs to come from without, just from someone else in their world, a family member, a caregiver that might be able to kind of spark that motivation. And we're hoping that this class might actually fill some of that gap as well. The second would be depression, and that's a really common emotion that we see following a stroke. This has been a life-changing event for someone, and so it's a normal that someone might feel depressed after a stroke. But we know that some of the benefits of exercise is that exercise can help with depression. You can get some good chemicals flowing through your body. So we know that exercise is linked with helping cope with depression. So it's an important part not only of the stroke recovery, but also of dealing with the depression that goes along with the stroke. The third would be the person is feeling that they're not physically capable of exercising. We've really looked at a broad spectrum of physical abilities so that we're really trying to address physical abilities from the very beginner, the new stroke recovery person, as they progress through the stroke recovery up into a more challenging level of activity. But it's really trying to address that beginner person, that person who doesn't feel that exercise is right for them, that they're ready for exercise, that they're even capable of exercise, and giving them a level of exercise that is appropriate for them to get started with.
We do a Susan Ealer video, exercise video, at least once a day. It's done on a chair in your home. You don't have to go out.
I mean, I go through, 3 or 4 days of doing the class, and then I'll notice, little incremental improvements. Doesn't change overnight, but it keeps getting better.
Reason for doing this is to get daily exercise, which really I find very, very helpful. So I highly recommend this program to people with strokes.
When rehab ends, where do you turn? And I have an easy answer, and that's Susan Ealer. She takes up where they leave off. And it's absolutely phenomenal what can be gained. Wonderful program.